I'm here with Dr. A. He's a New York Times bestselling author, a critical care physician, and an internationally recognized expert on health and wellness. And today we have the good fortune of being able to sit down and chat, and I hope you've enjoyed it so far, especially being out here in LA. What do you think?
I love it. Gosh, the weather's amazing. This place is amazing. There's a special spirit here. I can feel it.
All right, well, Dr. A, look, you are a critical care physician, a New York Times bestselling author. I'm hoping for those who are watching that may not be as familiar just yet, you could tell a little bit about your background, the work you do, and the vision, the bold vision, I should say, you have for impacting the world.
Yeah, well, I started in critical care, as you mentioned, back in basically the 80s. Studied at the University of Miami and Jackson Memorial during the Cocaine Cowboy Wars. It was a great place to really hang out and learn about that. You know, we're both Florida Gators, so we did our undergraduate there. Yeah, man, that's important to do the chop. I trained there and went out and really felt really equipped to take care of sick people, and also set up an open heart program at a teaching hospital in Dayton, Ohio. Did that for 20 years and really enjoyed it at first. Towards the end, though, it just seemed with managed care on the horizon, so much intervention by people that really had no vested interest in our patients. So went out to help create a new model of health and business, and created what I call a health network now, and started writing books on what it really takes to help people get healthy.
I recently spoke to another health and wellness focused physician who said that in our modern system, you know, we're keeping you healthy enough to keep you alive, but never actually getting you well.
That's
and
exactly
I
right.
kind of wondered, what did you think about that?
Yeah, I don't like that. And you know, our role as caregivers are really to empower people to be as healthy as they can be. So that's kind of what I've asked that question pretty much every day for the last 17 years. How do I help people make sustainable changes in their health and their well-being?
Do you think there is a one-size-fits-all, or what are some of the things you think on a system level could improve the way we practice medicine?
On the biggest system level, it starts with the surroundings. We need to change. We need to create what I've done is create a microenvironment of health. Surround people with the support, the structure, the tools, the skills, the strategies for them to do it individually. But we need to do that on a societal level. You know, David Katz, one of the leaders in that area, talks about the levee system, and we have a levee system, but we need to change everything in it. Food policy, you know, the way we address foods and foods that are healthy or unhealthy. We have to make a fundamental grassroots approach where our clients and our patients demand better care. And what I mean by that is be put into a system where they can develop their own awakening, their own responsibility, and then go out and change their own life with the proper tools.
This whole health and wellness movement to a lot of people sounds new. Sounds like a new trend and something that's new and exciting, but for someone like yourself, I mean, you were really a pioneer in this field long before it was trendy, long before it was cool. And I'm curious about your thoughts on what you've seen, this evolution of wellness and well-being in a popular sense over the past few decades, and what do you think, where do you see us moving in the future?
There is a change occurring, but it's only happening in certain groups. It's in little areas, in little pockets of areas where the culture's changed. In most areas, unfortunately, because of fast food, people don't have a lot of time, so they're still eating the wrong way. They're not moving enough. They're tied to their desk, and then also they're tied to their electronic leash, you know, their smartphone, and it's creating displacement. It's actually decreasing social interaction. There's so many things that, as it sits today, that our society and our environment don't allow people to be healthy. And actually, you know, one of the key parts is your relationships. If you're hanging out with people that aren't healthy, you're more likely to be unhealthy as well. People know they need to exercise, they need to eat healthier, but they don't have immediate consequences of it, so we need to make that a reality. So one of the areas, like, you know, if you have a burger today probably isn't going to have a meaningful change in your life, but over time it's going to dramatically change your life. But if we can show that after you have that burger and fries, that you have that real feeling you kind of get, and you feel kind of sluggish and heavy, right? So if we can actually relate that they're related, and that your productivity in the afternoon suffers as a result of it, now we make immediate consequences. So what I like to look at is both what's the immediate reward we can give somebody and the long-term reward. So you have to be motivated to change your life, but then day to day you need to have the tools in place so that you can do it every day, so it becomes a habit, so you do it automatically.
I was hoping you could, in broad strokes, you know, go over the key elements of the Habits of Health philosophy.
Yeah. It's really about helping people transform their lives. And to do that, they need to change their habits. You know, where we are today is a result of our habits from the past and our current habits. So to change that is not an easy thing to do. So we need to do it in micro habits. So that's kind of an area that I look at people's ability versus their motivation level. And we find things they can do every day to start building consistency. So you have to be motivated to change your life, But then day to day, you need to have the tools in place so that you can do it every day, so it becomes a habit, so you do it automatically.
Absolutely. Well, Dr. A, on behalf of the university, I want to say welcome and thank you so much for your incredible advice, your guidance, and for all that you do.
Great, awesome. It's great being here.